So, when we're talking about mental health stigma, what we're really referring to is societal disapproval, right? So, it's shame that society places on humans who live with mental illness, and also shame that is placed on persons who seek mental health treatment for emotional distress. And mental health stigma really, what it does, it reduces a whole person into someone who is spoiled or rotten or inferior. And so some of the common views of people who have mental health concerns include that they're scary, that they're dangerous, that they're impulsive. And oftentimes, people with mental health concerns are blamed for their emotional distress, especially when there is also co occurring substance abuse disorders. Next slide, please. So, when we're talking about mental health stigma, there are three types of mental health stigma, according to Dr. Bornstein, as well as the American Psychiatric Association. So, we have the public sphere, right? And involves negative or discriminatory attitudes that others have about people with mental illness. So, example of this would be the belief system can result in unequal access to treatment services or the creation of policies that disproportionately impact people with mental illness. Social stigma can also cause disparities in access to basic services, such as housing. And then we have this middle triangle that talks about self-stigma, which refers to negative attitudes, including internalized shame, as well as stereotypes that people with mental illness have about their own condition. An example of that would be including a person feeling guilty and inadequate about his or her own condition, which can lead to poor self-esteem. And then the last sphere that we have here includes institutional stigma. It's more systemic, involving policies of government and private organizations that intentionally or unintentionally limit opportunities for people with mental illness. Examples include lower funding for mental illness research or fewer mental health services relative to other services in healthcare that are available. So, what I'd like all of you to do is to pause and take a minute and examine what mental health stigma looks like in yourself, in your community, and institutions in your life. And keep those experiences in mind. And if you feel led, when we have our discussion, we can talk about what arises for you. Next slide, please. Also, when we're talking about mental health stigma, it's important to think about what are some of the harmful effects of mental health stigma. And so, really, what it does is it impacts us in every sphere. So, if it can occur in the self, in the public, and institutions, it's important to remember that harmful effects of mental health stigma can also occur in each of those spaces. And so we're really talking about the reluctance to seek treatment or help, as well as poor treatment compliance, social isolation, the lack of understanding from family, friends, and coworkers, fewer opportunities for school, social activities, or work, trouble finding adequate housing, bullying, violence, harassment, as well as health insurance that doesn't adequately cover the cost of mental health treatment. And as a provider, I personally have a lot of experience with this, where insurance companies would require patients to pay 3, 4, 5, and sometimes I've seen $8,000 deductibles that have to be met before the insurance company would pay for an outpatient provider, as well as poor self-esteem. So the belief that you'll never be able to exceed or to get past certain challenges is definitely also a harmful effect of mental health stigma. Next slide, please. So when we're talking about the harmful effects of mental health stigma, I like us to also explore things that directly impact Black and African Americans. So, an unintentional consequence of mental health stigma is misinformation and denial that certain health or mental health conditions impacts one's community. Mental illness is no respecter of person, unfortunately. African Americans make up about 13.3% of the American population. But when we look at results from the SAMHSA's 2018 National Survey on Drug Use and Health, it revealed that about 4.8 million, so 16% of African Americans reported mental illness, and about 1.1 million of those individuals reported having a serious mental illness. So that would be something like bipolar disorder or disorder that's causing psychosis or personality disorders. Also, suicide within the Black community has often been something that's written off that doesn't impact us, right? And it's true that Black and African Americans are less likely than white people to die from suicide at all ages. However, Black and African American teenagers are more likely to attempt suicide than white teenagers. And so this is something that's really important to address because our young people are feeling inequipped with the psychological fortitude that they need in order to overcome some concerns. So when we talk about the harmful effects of mental health stigma, what tends to happen in communities of color is that Black and African American people are often diagnosed with schizophrenia and less often diagnosed with other mood disorders like anxiety or depression compared to white people with the same symptoms. Additionally, Black and African American people are offered medication or therapy at lower rates than the general population. And so what's happening is there's a discrepancy in how to understand how emotional distress impacts Black people and how they exhibit that. Also, Black and Latinx individuals make fewer mental health care visits and are less likely to fill initial prescriptions for psychiatric medication than whites, even when we're controlling for socioeconomic status. And so there's a really big problem because mental health impacts the Black community, but seeking mental health treatment is lacking. And there's also a shortage in diverse treatment providers. And so, what we know from research is that Black and African American persons prefer to see clinicians who resemble them or look like them. But however, there's only 21% of psychiatrists, 13% of social workers, and 8% of psychologists that identify as racial minorities. And so this makes it really difficult for Black and African Americans to seek treatment when there's distrust with the medical system. Next slide, please. And so what do we do about it, right? So we have to fight back against mental health stigma, and we have to develop some big, audacious goals. And so when I'm working with patients, I typically say to them, okay, we have to develop a therapeutic treatment box for you, right? What are things you can pull from that can help you in our process together to manage some of these mental health stressors? But for the purpose of this presentation, let's just say I need you to get a bag, right? So sis, what's in your bag? What are some of your big audacious goals that can help you combat mental health stigma as well as the stressors that you're currently experiencing? Next slide, please. And so what I'm suggesting is that as warriors, we fight back. And so our bag must include what I call tribe, right? And so the first step or thing that's really important in your bag is to have your treatment dream team. And so when you're also managing a chronic illness, it's important to have healthcare workers that can address your physical symptoms as well as your psychiatric symptoms. And so don't be afraid to ask for clinicians, so providers as well as mental health clinicians who are of color. right? As clinicians, we are required to fill out certain identifiers with insurance companies so that when you call your insurance provider, you can locate someone who have certain identities that resemble yours. So don't be afraid to have treatment providers that look like you, as well as challenge yourself to trust some providers that don't look like you. I also think that in your bag should be included some resources, right? A lot of times, local resources in your county might not be available, but there are resources that you can use that might be regional or national. There are agencies out there that are willing and wanting to help MS warriors. So just because a desired resource might not be available in your community, it doesn't mean it may not exist. So I would definitely suggest reaching out to the MS navigators who can help you identify resources that you need within your area. And then I also definitely encourage patients to have your invisible warriors. And what I mean by that is spirituality, right? So whether it's your ancestors or angels or the divine femininity or masculinity within yourself that you tap into, it's really important to also have spiritual connections outside oneself that can help you really get through tough moments. And research supports that spirituality and religion has always served as a protective factor against mental illness within the Black and African American community. And so it's important to have a combination of both, right? You have your physical treatment providers, you have your mental health clinicians, and then you also have your spiritual self or the divine that you use in your bag as well. And then we have B for boundaries, right? It's important to get you some boundaries. It's important to set boundaries with yourself and other people. It's important to be clear on who you are, what you want, and what your values and belief systems are. And so this is something I work with patients a lot on, especially when you have a chronic illness, setting boundaries about who have access to you, who has access to your psyche is important because stress can exacerbate MS symptoms. And then the last thing in tribe is embodiment. So you cannot tap into your warrior power and also avoid tough emotions. It's just not possible. So we must integrate and make meaning of our emotional experiences. We must learn to love and accept all of who we are in order to fight back against mental health stigma. Next slide, please. And so, for my final words in this brief kind of discussion about mental health stigma, if you all are willing, I'd like you to place a hand on your heart and also a hand on your belly and to repeat after me. Mental health stigma, you do not serve my highest good for my earthly being. And as a warrior, I will fight back by finding my tribe.